Knowing how to deal with rashes in babies and children tends to be one of those core concepts that every parent should be capable of dealing with. After all, we can try our best to eliminate potential causes of rashes and all kinds of illnesses, but it's impossible to stop things happening entirely. However, dealing with rashes in children can be significantly easier than you may have previously imagined. In fact, it will often prove to be less stressful than you may have feared. So, if you are wondering about how to deal with symptoms of chickenpox, baby acne, cradle cap, measles, psoriasis, and a whole lot of other skin conditions, then we are here to help. Many things can cause rashes in children, and they're often nothing to worry about. Sure, it will prove to be rather uncomfortable for your baby or child, but there are a number of things that you can do to help make them feel better. As we said, there are a number of different potential causes of rashes developing in your child. The most common way is by your baby or child coming into contact with someone that already has the rash. That is why you often hear that there has been an outbreak of chickenpox or some other rash in a school. There are other reasons linked to genetics, hormones, and even glands not working correctly, and this can then lead to issues such as cradle cap. The same goes for skin conditions, as the causes will tend to be the same as they are in adults or older children. As so many of the rashes in children come from them being in close proximity to others, there needs to be the acceptance that you are restricted in your ability to stop it happening entirely. What this then means is that you must become aware of the steps to take in order to treat rashes in the first place. Of course, the best place to start is going to be with identifying the problem. The treatment method will vary depending on what is wrong, and even though a number of the rashes are easy to identify, you still want some medical advice to be sure. It's also worth remembering that even though these rashes are uncomfortable for your baby or child, that they will still not cause them any long-term problems. Once you have identified the problem, it's then on to treating it. However, you need to be aware that there is not always a cure, with chickenpox being a prime example. Instead, it is all about dealing with the symptoms and making your child as comfortable as possible, no matter the types of rashes you are dealing with. Aside from applying the correct treatment, you also want to make sure that you remove the discomfort that comes with a baby rash. It's harder since your baby is unable to tell you exactly what is wrong, so you need to make some decisions of your own. You will be aware from your own experiences of a rash that it will often be itchy or hot. First, take steps to ease these symptoms, as they can be very unpleasant for your child. Applying calamine lotion will bring some comfort, but it won't cure the rash. There are other creams and lotions specially formulated for baby rashes that you can use as well, and they're usually easy to apply. If their rash is itchy, then you need to prevent them from scratching it. Once again, applying the correct cream or lotion will make a huge difference. Here are some more helpful tips you should consider. Applying a cool wet cloth over the rash can ease the stinging or itchy feeling. Cut and file your child's fingernails so they are short and smooth. This will prevent them from scratching the rash and causing more skin damage. Getting your child to wear soft gloves at night will also reduce the chances of scratching. You want to look out for other symptoms that can be attributed to the cause of a rash. For example, if they are developing a fever with the onset of chickenpox, then it is important to treat the fever. Keep your child hydrated and cool. Due to the number of rashes that your child could be afflicted with, you must be careful to be vigilant and evaluate symptoms on a case-by-case basis. While getting your baby or child seen by a doctor should be high on the agenda, it can be difficult to get an appointment quick enough. In the meantime, a pharmacist may be able to offer you advice and solutions to help. This is especially true with issues such as cradle cap, nappy rash, measles, and even ringworm. There are various lotions and creams that can be bought over the counter or prescribed. As you can see, dealing with rashes in babies and children need not be as stressful as you had perhaps feared. Of course, if you are unsure about anything, then call or see your doctor as soon as possible. One of the most important things to remember is not to panic. Children pick up rashes for a whole host of reasons, and it is just a part of growing up. but how you deal with it can have a major impact on your child's well-being. Thank you for watching this video from Mama Select. If you liked it, please subscribe and follow our blog below.